Thank you to everyone for listening to my video. My name's Steve Kent. I'm a local orthopaedic surgeon in the Newcastle, Hunter and Lake Macquarie area. My area of expertise and specialty is foot and ankles orthopaedic surgery. We're going to give a talk today on common ankle problems in football players. It's the first part of a three-part series, particularly focusing on what's called a low ankle sprain. I'm proud to say and privileged to say that I'm a sponsor of the Broadmeadow Magic this year, so hopefully we can provide you some regular content. If you are interested in any foot and ankle injuries or you want to look anything up, you can certainly take a look at our YouTube page, which is the Foot and Ankle Orthopaedic Surgeon. The other area to find some information regarding foot and ankle injuries is our Facebook page, is listed there. Certainly we have pretty regular flyers and videos on that site, and then the best place to go is our website, www.hunterfootandankle.com.au. We've got a regular blog there, videos on injuries, and we certainly critique injuries in the NRL, A-League and the AFL. Now, a few facts about football injuries. So, unfortunately, they're fairly common. About 33%, so about a third of them are due to player contact on contact. So usually, slide tackle, players competing for the ball, that sort of thing. They make up the majority of presentations. We do see an overuse injuries in about 26% of cases. They make up the sort of the other main group, and they're usually weekend warriors, mums and dads that have been playing sport for a while and then return. The good news for mum and dads is that only 1% of injuries in football are due to fractures. That's quite comforting if you've got kids that are trying to take up the sport. But almost 8 out of 10 of the injuries suffered in football are on the dominant foot. So that tends to mean you're likely to be out for a bit longer because you do most of your kicking, your dribbling, that sort of thing with the dominant foot. But it does make up most of the injuries. Now, foot and ankle is not the most common area of injury. The thigh is actually the most common injury in football, and the foot and ankle is actually placed second. So that's just an interesting fact to know. But the three most common ankle problems I see in terms of football players, the most common is an ankle sprain, which takes up about 80% of presentations, so the most of them. There's something called ankle impingement, which is pain at the front of the ankle from spurs, which we commonly see in soccer players. And then the third is an Achilles tendon rupture, which is what we commonly see in the 30 to 49-year-old age group. We're going to focus on ankle sprains today. That's what our talk's going to focus on. And then in the future videos, we'll look at the ankle impingement and Achilles tendon rupture. So in terms of ankle sprains, there's actually two types of ankle sprains. One's called a low ankle sprain, which is your garden variety ankle sprain, the one we all know, where you roll your foot in. That makes up about 85% of presentations. There is another type of sprain which is more sinister, known as a high ankle sprain, and that's actually what we know as a syndesmotic injury, which you hear about in the NRL commonly. Now in soccer, it's classed as a contact sport, and so the high ankle sprains actually take up about 25% of presentations, so 1 in 4, and that's the same for league and union, so we just have to be mindful of that, and we'll have another video on that sometime later. Now this is a crude drawing of the ankle joint. When looking at it from the front, we're just going to label the tibia here, which is your shin bone. Alright, and then next to it is a small bone called the fibula, which makes up the knuckle on the little toe side of your ankle. It takes about 1/8 of your weight. We will also mark for you the heel. So the heel bone is known as the calcaneus, and it's just sitting at the bottom there. And then the area in red here is what's known as the syndesmotic ligaments. Now ligaments are sort of like ropes between the bone, and the syndesmotic ligaments are the sinister ones that we'll talk about in a later video. But the ones we're going to talk about today are the ones in green. They're the lower lateral ligaments, and they're known as the ATFL and the CFL. And so they're marked there in green. And we're just going to go through how they're injured, the mechanism, how they might be treated, and what the sort of reasons you may need surgery for a low ankle sprain, although it is uncommon. So, in terms of the mechanism of injury, the foot goes into this position, so it's called an inversion injury. The big toe goes up, the little toe goes down, and all the pressure is placed on the outer aspect of the ankle, the little toe side of the ankle. And this is a better set of diagrams for us to show us exactly what happens in an ankle sprain. So this is a cricket player that tripped on a rope. Now this is where his ankle is straight up and down, and so the diagram is very similar to what it looked like in the previous slide. As his foot starts to roll in, his heel starts to move more towards the big toe side of the ankle, and pressure is placed on those outer ligaments on the little toe side of the ankle. Now his foot's really rolled in on that third photo there, and you can see that his heel's really rolled in, and that puts strain on those green outer ligaments, and in this case they've ruptured as a result, and so this patient will have a lot of pain on the outer aspect of the ankle and a lot of swelling. Now, in terms of where you're likely to be sore with an ankle sprain, it's in this area here where the arrow is, so just below the knuckle on the little toe side of the ankle. But sprains can be tricky and they can be sore in a lot of other places. So the area in red there is actually where the syndesmosis is, and a lot of patients will be actually sore in that area even though they don't have a syndesmosis injury, and so that's about 60%. And patients will also likely be quite sore on the inner aspect of the ankle, so the big toe side of the ankle, in about 40%. And the other thing is, it's very, very hard to know exactly where people are tender, usually in the first 24 to 48 hours after the injury. So it's actually better to get checked initially and then again sort of 5 to 7 days after the injury. Now, physios, doctors, everyone in medicine likes to grade injuries because it usually guides treatment. Unfortunately, in these type of injuries, it doesn't. A grade 1 injury basically means it's just minor of everything: minor swelling, minor pain, can walk reasonably well, not much in the way of instability symptoms in the ankle. Whereas a grade 3, which is the worst grading, means that you get lots of swelling, quite tender, difficult to walk, and feel unstable. The good news though is that despite whatever grade you've got, it's very likely that you'll recover well with good treatment and you shouldn't need an operation in most cases. And the way it's initially treated is with something called police therapy. And no, it doesn't involve the police, but it's just a good acronym to let us know what's going on or how the best way to treat things. So the first one is P, which is protect, meaning that if you go back to play and train in the future, you need to wear some level of ankle brace that reduce, or even taping, as that reduces your risk of having a sprain again. Optimal loading means if you're really sore, you need to keep off it for sort of 4 to 5 days as a minimum, whereas if you don't have a lot of tenderness, you can actually get back to using it, but you probably don't want to get back to sport straight away. As most people know with first aid, ice is a good thing. It helps to reduce swelling, and it's particularly useful in the sort of first 48-72 hours, so I would recommend that. Compression is also useful as it can help to keep the swelling down, although the most essential thing is actually to elevate the leg. So if you keep the leg elevated above your heart on 2 pillows, that will help with the swelling enormously, whereas if you have it down for just 10 minutes, it will swell up like a pumpkin. So all of those are simple things you can do. But the thing you really need is aggressive physiotherapy. Really, all ankle sprains should have physiotherapy, and that's for number 1, to return your movement, so the range of motion, back to the movement similar to the other side, your good side that's been uninjured. The next thing you have to do is try and strengthen the outer aspect of your ankle, so the muscles and tendons on the outer aspect of your ankles, so that you're less likely to sprain the ankle again. And the third one is something called proprioception, which we'll explain shortly, but basically it's knowing where your leg is in space. Now, those are good treatments, proven to work and very effective, but there are other treatments that people offer that are not shown to be effective in terms of they're not harmful, but they've not been shown necessarily to improve things, and one of those is low intensity ultrasound. The evidence for that is not great in terms of showing a clinical improvement. The next one is laser therapy. That has also not been shown to provide a clinical improvement. And then the third is something called electrotherapy, which has also been shown to not provide much of an improvement. Okay, so those things are probably not that useful and not worth shelling out your dollars for. Now, in terms of proprioception that I was talking about today, I was talking about just before. So this is Super Steve. He's got his hand up, but you can see here that his eyes are pointing forward. Now, he knows his hand's up even though he can't see it, right? And that's a pathway between the brain and the hand and other parts of your body. And so that's what you lose that ability in your foot when you injure it, and that's something that physiotherapists can work on to reduce your chance of having a sprain in that area in the future. In regards to return to play, so the average layoff in soccer players, and these professional soccer players, is 7 to 18 days. And most athletes will get back in less than 4 weeks, but most of us aren't part of professional teams, and so you've got to probably add 2-3 weeks at least in each of those figures. In terms of possible repercussions of the injury, well, 40% of patients have some sort of grumbling problem, and that's probably because they don't get physiotherapy or aren't treated initially, or there's some other problem. The big thing to know though is you have up to a 5 times risk of having another sprain if you sprained your ankle. So you really need to wear an external brace to reduce your chance of it happening again, and this reduces the chance by about 70%. Now, when I tell patients they need to do this, the response I usually get is, I don't like the brace, or I won't be able to play as well if I'm wearing it, okay? And that's pretty common. So, and it's been studied that only 27% of soccer players will wear the brace when it's recommended, because they think it's going to impair what they do or it's going to feel uncomfortable. The good thing is someone's actually studied it. So They took a study where they had 15 women and 5 men. And what they did was they trialled them with and without the ankle brace, and they put them through their paces. So they tested them on shooting ability, so shooting accuracy, speed in a 40-yard dash, and something called a T-test where they went back and forth and side to side, and both with and without a brace, 7 to 10 days apart, and the results were exactly the same. Their speed was exactly the same, their shot accuracy was exactly the same. So that means that if you train with it, you should be able to use it, and that'll reduce your chance of having another problem. Now, the next question I often get is, in what circumstances may I need surgery? Well, it's really if your ankle continues to be unstable despite you having good physiotherapy for 3 months. Then I might need to tighten up those ligaments there. The other reason is if you have some level of ongoing pain, because your pain should cease after about 4 weeks with an ankle injury. And what we're showing here is a piece of cartilage that's come off when someone sprained their ankle. So if your ankle continues to be sore and is not improving after sort of 4 to 6 weeks, you probably need to see someone to get it looked at. Now the other problem is anterior ankle impingement. So what that means is a bit of scar tissue over the front of the ankle that's just getting caught whenever you bend the ankle up, and that might need to be cleared, say with what's called an ankle arthroscopy or keyhole, to be improved. The third problem is ankle instability because of the position of the foot. You can see the heels are both pointing in that picture, and no matter how much physio you get, that patient will continue to have problems because of the shape of their foot, and I might need to change that. And then the fourth one is if you do another injury at the time of the sprain, and these are what are called the peroneal tendons that run around the back. So if you keep getting pain at the back, outer aspect of the ankle, you may need that looked at. So, thank you for listening to my talk. Please take a look at our YouTube channel or our website or Facebook page to get some more information. I will have further videos following up from this, and if there's something you would like me to talk about, please drop us a comment or an email. But please visit our website, hunterfootankle.com.au, and good luck to everyone, and thanks for listening.